Hi, I'm Owen Preventure, and this is The Connection. Welcome. Our guest today is John Skevington, the CEO of Parkland Medical Center. Parkland serves southern New Hampshire with comprehensive and personalized medical care around the clock. Hi, John. Thanks for joining us today. How are you holding up these days?
Hi, Owen. Thanks for having me. We're doing well.
Excellent, excellent. Listen, let's get right into it. As CEO of Parkland Medical Center, what has it been like leading the organization through a pandemic and an unprecedented time such as 2020?
Well, you really hit it. It's been unprecedented, but overall, it's been a profound honor to be able to do that here for this organization. Early on, through the first surge, we took care of 20% of the state's hospitalizations, and we did a phenomenal job serving this community in southern New Hampshire in doing so. And it's been an honor to be able to do that.
Give us an idea of the scope of what that's been like. How many COVID-19 patients has Parkland Medical Center treated, and do you currently have at this time any COVID-19 patients?
We treated close to 200 COVID-19 patients between inpatient and outpatient, and currently we do not have any COVID hospitalizations.
Gotcha. Wow. Now, throughout the pandemic, the hospitals continue to care for all types of individuals with all in many situations and emergency needs. And from what I understand, in May, you resumed care for elective procedures even. Can you talk about how the hospital has managed to care for both COVID and non-COVID-19 patients simultaneously?
Absolutely, I'd be happy to. We use a term we call universal protections, and within that, we employ a couple of strategies to be able to take care of COVID and non-COVID patients. First and foremost, we have everybody in the building being masked. So all of our caregivers, all of our patients, and now that we are allowing visitors, visitors are masked as well. We also do rigorous screening. So before you come in for your appointment, before any of our medical personnel actually begin seeing patients whenever their shift is, everyone is screened, their temperature is taken. We go through the CDC's recommended questions. And if anybody were to be suspected of having COVID or having contact, we would make sure that we're carefully vetting that before we started to care for patients. And then for patients, we have set up schedules to be able to separate any COVID or suspected COVID patients from COVID patients. We have designated care areas for COVID patients. And then the third component of our universal protections is, of course, a gold standard infection prevention program where we are not only making sure that we're keeping our staff and patients safe, but we've got good accountability to ensure that we're wiping down surfaces. We are social distancing within our own facility to make sure that we're limiting the potential exposure for patients and staff.
Wow. It sounds like a lot, and you and your team there, and everybody over there at the organization has done a lot to really ensure the safety of your staff and, of course, the patients that come in. Great work. That said, some folks may still be hesitant to seek care, even if they've got an emergency in light of all this. What message do you have for those individuals, and dig a little deeper maybe on the protocols in place to ensure that the safety of patients, of them coming in and your staff?
Yeah, I'd be happy to. First I would say that I understand their concern. And I would also say that we've been able to take care of COVID and non-COVID patients, so to speak, walk and chew gum at the same time. And we do that through those universal protections that I outlined. We're going to make sure that our caregivers are masked. And we've been able to do that with thousands of patients since we reopened in May without compromising any patients or our staff members. And so, what we didn't know back in April and May, we know now. And we have learned how to successfully care for patients. So while I understand someone's concerns, I would try and reassure them that we do have the ability to take care of them and make sure that they're safe while they're here. Um, One example of that, whether it's COVID or non-COVID, we're a Leapfrog A-rated organization, which means we take patient safety. We've got the highest rating for patient safety by the Leapfrog organization, and that doesn't just happen. That is something that's ingrained in our culture. And so whether you're talking about COVID patients or non-COVID patients, we're going to make sure you're safe.
Excellent, John. Thanks for that explanation. Um, as witnessed this morning when I stepped out of the house, autumn is upon us. Flu season is upon us. Um, how is Parkland prepared for the convergence of flu season and a potential surge of COVID-19 cases this fall and throughout the coming winter?
Yeah, primarily we just haven't been complacent. Since March, we've been running an emergency operations center where we have been developing surge plans. We've been tracking our PPE. We've been coming up with contingency plans. And we've kept that up throughout the summer. And now we know that there's always the possibility that there could be another surge. Thankfully, here in this community, the transmission rates have continued to be low, particularly compared to other areas in the country, but we're not allowing ourselves to get lulled into a sense of complacency. And so our emergency operations center continues to meet on a regular basis, and we're keeping those plans in place if there is a surge.
Gotcha, gotcha, excellent. Now, let's talk about you as CEO. What lessons have you learned? Again, this is an unprecedented time. I can only imagine. You know, this is where the rubber hits the road. When it's business as usual, you know, status quo, you kind of get used to the process, the procedures. Something like this comes along, got to move swiftly, got to pivot, got to respond. Fortunately, you've got a support of great networks throughout the region and even the country, from what I understand. What lessons have you learned, and do you feel Parkland is in a good position to continue managing the pandemic moving forward?
Certainly, yeah. My first day here was actually March 1st, and of course, that's really when the pandemic started. So, welcome, right?
Yeah.
But I, like you said, I leaned on relationships that I've had. I previously served here as the chief operating officer. We've got the great support of HCA, which is a national hospital company. And so, with that support and with all the great relationships, I feel like we handled the surge very well. Like I stated, we took care of 20% of the state's hospitalizations. That was not a surprise to me. And that really enabled us we worked very closely together to be able to accomplish that. That doesn't happen unless everyone is working really well together. And that's what we've always done here at Parkland. And what we were able to do is prove what an asset that I think Parkland Medical Center is for this community. So not necessarily a lesson learned for me because I knew that, but it's something that I'm very happy to share with you, with the rest of the community, to make people aware.
Gotcha. Excellent. John, that's the time we have for today. I want to thank you immensely for taking time out of your busy day. You've got a lot going on. Thanks for letting us know and allowing us the opportunity to share with the community a little insight of what's going on and the perspective behind the scenes at our community hospital, Parkland Medical Center. Thank you, John. We really appreciate it. And anytime you want to reach out, please feel free to do so here at Derry TV.
Thanks for having me, and don't forget that your viewers can go to parklandmedicalcenter.com and check out our COVID resources.
Absolutely. We'll let them know for sure. Thanks, John. You take care. Again, a big thanks to Mr. John Skevington for taking the time to talk with us today. If you'd like to learn more about Parkland Medical Center, visit their website at parklandmedicalcenter.com. If you know a story that needs to be shared in Derry, let us know by going to DerryCAM.org/The Connection. We're always looking for great stories to share. Until then, see you next time. Stay connected. This is Owen Preventure signing off. Bye now.